If you didn't hear, I'm pregnant. Mallory is
What?
postpartum. Mallory's 8 months postpartum. And so we have been immersed in maternal conversations for the better part of the last couple of years. Today, we have an expert who is joining us from Congress. We have Lauren Underwood joining us today on the podcast, and she's going to tell us all about the Momnibus. I'm Maggie Gelson Burnett.
And I'm Mallory Hagan. This is Pretty Furious.
I am so
Yay.
excited for this conversation today.
That yay really did it. That let us know.
Okay, so first of all, I it's been 84 years. I have been pregnant for so long. We have been just in the trenches over here. But yeah, we have Lauren Underwood joining us today. And you know what? I do have to say, as an Illinoisan, an Illinoisan? Is that how you say it? I guess. I
I
don't
don't know.
know.
You live there, not me.
Grew up in Iowa, so I don't fucking know. But I'm very excited to chat with Lauren.
Me
I
too.
think that the Momnibus is amazing. I'm so excited for her to tell us more about it. But before we get into this amazing conversation with Lauren, we want to be sure you're following us everywhere. We are at
Yeah.
Pretty Furious Pod, literally everywhere, prettyfuriouspod.com. You can submit any kind of review you want. We'll get into
Oh
that
no.
later this week.
Maggie received some, they weren't even reviews, they were emails, like
They
direct
were, yeah,
correspondence.
they were like submit forms on your website, which is like probably worse.
I Listen, we're not going to read them on this episode for obvious reasons, but
Yeah,
I think what happened was you said something online that just made somebody mad, and they were like, I'm going to go tell Maggie that
absolutely.
she's crazy.
Absolutely. And I stay making people mad. Um, it's one of my greatest gifts, actually. But yeah, follow us everywhere. YouTube, Spotify, Apple Podcasts, Substack, you know the drill.
Yeah.
What else? What else we got?
Well, so we're not going to do headlines this week. We're actually recording a little bit earlier than we normally do. So if you're wondering, where are their headlines? We're just going to jump right into the subject matter. We really want the conversation to stay focused on Representative Underwood's work and what we can all do to support that work. But I do just want to fun fact it. We ran at the same time. So when I
That's
was running
right.
in 2018 in Alabama, Representative Underwood was also running. And it was just so powerful at that time to be a part of. I think if I remember correctly, there were more women running for office in 2018 than there ever had been in history. Um,
Wow.
much because we all looked around and went, I'm sorry, excuse me?
What's happening here?
Excuse me? You mean to tell me Donald Trump just won an election instead of the most qualified person to ever run for president?
Literally.
No. Yeah, so that was really neat. This is going to be a really neat conversation for me. Just having that proximity to sort of following her race and at the time AOC and some of the other women who ran as well. So I'm looking forward to it. So Representative Underwood has represented Illinois' 14th Congressional District since 2019 and is the first woman, first person of color, and first millennial elected to serve the district in Congress. She is a registered nurse. She has co-founded and co-chairs the Black Maternal Health Caucus and serves as co-chair of the House Democratic Policy and Communications Committee, while also serving on the House Committee on Appropriations. So obviously she's just like hanging around eating bonbons. Before Congress, she worked at the U.S. Department of Health and Human Services, where she helped implement the Affordable Care Act and strengthen the nation's public health preparedness. Representative Underwood is a graduate of the University of Michigan and Johns Hopkins University, and she lives in Naperville, Illinois. Let's welcome Representative Underwood.
One of the things that Mallory and I were kind of talking about before having you on is that you ran in 2018 after your representative kind of changed his tune on healthcare, which reminds Mallory and I of a book that we both really like, which inspired this podcast, which is a book called Good and Mad by Rebecca Traister.
Yes!
So it's, yeah, all about women's collective anger and, that being the catalyst for change. So you ran because you were angry. So what keeps you in the fight today?
Oh, I'm still working on healthcare issues. I have never lost sight of the need to help the American people have high quality healthcare, that it needs to be affordable, it needs to be great quality, it needs to be close by, and there's too many folks who are experiencing bad outcomes because they're getting bad treatment when they enter a healthcare facility, and it's leading to enormous healthcare disparities. And so we've been laser focused on this issue and have found some pretty significant success in being able to extend the very popular ACA tax credits for a number of years. We're still waging that fight, of course, and then obviously our focus on maternal health care. And so we're not giving up on healthcare issues, and it's been a real joy to be able to do it from the United States Congress.
Yeah. You're thinking of those subsidies and the ACA and just the big ugly bill, as we should call it, clawing those things back from Americans who very much need them. Their healthcare costs are on the rise, and many people have seen that from December of this past year until now. People saying like, I was paying $300 a month for insurance, and now I'm paying $1,000 a month for insurance. It's really become difficult. To have sort of bipartisan conversations when you've got an administration that's betraying people left and right. A lot of people might not realize that you're a really, really accomplished legislator. You have accomplished so much in a bipartisan way. And I know how difficult that can be, especially winning over and over again in a purple district that was once long held by Republicans. What is your secret for reaching across the aisle and bringing people into your fold? We
What's
struggle.
interesting is that I just try to build relationships with my colleagues. And when I see a small opening, I just introduce that conversation. And I think what's important is that, like, I don't gossip about people, right? The conversations are not going to leak, and people know that. And then at the end of the day, like, there are some shared values. And so at first, when I got elected, I thought I was going to find what I called my Republican bestie, the person that I'd be able to work with on all the issues. And that's not what I've encountered. There's some people I can work with veterans issues on. There's some people I can work with on cybersecurity. Some people I can work with on maternal health. And so after identifying those collaborators, we've had a really fruitful, productive legislative relationship and are able to get things done and across the finish line so that it helps our communities.
What about the constituents? Like, what about the people in your district who, we're obviously very divided. We need those crossover votes in a lot of places. We need people who are middle of the road. What do those conversations look like with people around you at home?
The most important part about reaching out to folks is showing up. I found that there's a lot of value in showing up and having a town hall meeting and being willing to turn over that microphone and just listen and hear what's on their mind, what their life experience is, what's not working for them, and then coming back when we have a solution to get their feedback. I found that when we are able to walk into a small town and meet with the mayor and identify a water project and actually get it done, work together to completion, it brings a lot of credibility. And we've been able to build relationships with constituents who are very much Trump loyalists. You know what I mean? Who probably don't even vote for me, but they trust that we'll keep our word. They trust that we care and understand their business if they're a farmer, or care and understand what's going on with their family, and that we're going to work hard on their behalf.
Yeah. As Mallory noted, you have made great strides in both healthcare, veterans issues. You've passed important legislation on both fronts. Now you are centering your focus on maternal health, which is a topic that's very important to Mallory and I. She became a mom about less than a year ago, and then I'm due in about 4 weeks here. So tell us about the Momnibus.
Well, congratulations, ladies. That's such exciting news. I hope, Maggie, you have a smooth and easy labor and delivery and have a strong and healthy baby. We're excited to be able to cheer you on and meet him or her, them, in a few short weeks here. So, listen, the Momnibus is designed to end America's maternal health crisis. And for those who aren't familiar, you're likely familiar with the stories, whether it's Serena Williams or Beyonce Knowles, or our fabulous Olympians who've all stepped forward and told their stories of really difficult, dangerous, birthing experiences, near death experiences, right? And what we see is that America leads the industrialized world in preventable maternal death. And Black moms are the ones that are most likely to die in this country because of racism and discrimination within our healthcare system. So we introduced a bill. We recently brought it forward again this Congress back in March. It's 14 bills in one. We call it the Momnibus. It's a play on words. It takes the legislative word omnibus, which means big bill, but for moms, so Momnibus. And it's designed to address every clinical and non-clinical factor leading to preventable maternal death in this country. So that's everything from tackling suicide and overdose, which is the leading cause of maternal death, to dealing with social determinants like housing and nutrition and healthy environments. We're trying to increase the number of providers. So if you want a doula, or if you want a lactation consultant or midwifery care, that you have a choice of providers no matter your zip code, right? That's what's in the Momnibus. These really important, like straightforward solutions to solve a problem. As I like to say, this is not a cancer moonshot. We're not trying to stumble upon a cure here. We're just trying to invest in what the scientists, the experts have told us work so we can scale up those solutions.
Yeah. You bringing up, doula and providers and things like that. I feel very fortunate. We're a military family, and I'm extremely fortunate to have the coverage that we do. And even saying that and being as privileged as we are, the option to have a doula meant that I had to come out of pocket for it. And so we ultimately chose not to because it just wasn't in our budget at the time. And so I think people maybe don't realize just how important those things can be in having a safe delivery process or having someone to advocate for you in a situation. And we know that specifically Black women are not heard in the same way that white women are in that situation. And so one of the questions I have is, how does the Momnibus directly target some of those racial disparities, like women being heard in the delivery room, rather than just, maternal mortality more broadly?
Well, let's take the provider issue specifically. We know that for so many moms in this country that they don't have any provider, that there is not a maternity care provider for miles and miles, hours and hours away. So we just know that number one, we need more providers. But instead of just saying, oh, let's just grow the workforce, no, let's make sure that we have a choice. So we're not going to be prescriptive and say that you must have an obstetrician or you must have a midwife, right? Let's empower that mom to make the decision that's best for herself and her family during this really important time in their lives. And if, that mom needs some additional support like a doula or lactation consultant, they should have those providers available in their community at an affordable rate, right? Like they should be covered by insurance. They should be covered by Medicaid. We're also trying to make sure that there's some diversity in that workforce. Why? Because the data tells us that if that mom is able to pick amongst providers that maybe share their same language or cultural background, the outcomes are better. And so that's how we're able to tackle these disparities, right? We're able to also in the Momnibus create some financial incentives for healthcare systems to improve the quality of care that they're offering so that, the healthcare that they're providing is better for everyone. And they're getting a little financial incentive to do that, right? And then we're just being clear eyed. If the leading cause of maternal death is moms who are dying by suicide or overdose, we are going to tackle that problem and make sure that there's solutions in community accessible to that mom.
When you say invest in those providers in, more rural communities, like I'm thinking I live in Alabama, as I mentioned, healthcare deserts all over this state, right? No shortage of prisons, but definitely anyway. And so I think like when you say that to the average listener, what does that mean? Are you investing in school for more doctors and more nurses, or what? When that legislation comes to the table, what is the investment really in order to ensure that those providers are in those communities?
So the investment is in their education. It's also if they need a certification. So let's say that maybe you're a psychiatrist, but you want to get a specialized certification to care for a mom who's either, in the prenatal period or the postpartum period. Make sure you can get certified to do that. Get that extra training, right? That's what this means. And so this would be the first time that the federal government is investing in doulas. The first time that the federal government is investing in lactation consultants, the first time the federal government would be investing in non-nurse midwifery care. So if you pick a professional midwife or certified midwife, right, that we would be able to open up a pathway for affordable education. That's how we're able to grow the workforce. And it would unlock federal dollars to be able to support better maternal health outcomes.
Yeah.
I'm sorry. I have one more question too, Maggie. I'm like, I
Go
have so
ahead.
many questions. My next one, and then I will shut up, is how does all of this look in a very anti-DEI world right now? Like, we're talking about race, we're talking about subsets of people and socioeconomic status in an administration that's eliminating any conversation about those things everywhere you look. How do we overcome that for the Momnibus?
Well, what's really important is that the definitions are written to target the communities that are most in need, but we're doing it in a way that gives communities flexibility. Okay, so we're not coming down on high and saying, you have to do X, Y, and Z, while creating a structure and a framework that offers resources that are be able to get in and solve the problem, right? Because this is like a resource issue. And I would also say that we know that when we improve maternal health outcomes for Black moms, it improves them for all moms. And so this is a crisis that reaches all of us and all of our zip codes, and we really try to tell the story in a way that doesn't other make people feel like an other. Do you know what I mean? Like, we're not saying that, what happens in San Francisco is like the only way forward, or what happens in New York City is the only way forward, and if you're not there, then you're treated as this other that is somehow behind or irrelevant, or not important or worthy of investment or consideration. What we're doing is we're saying, listen, there are opportunities. There's some money on the table. It lets you solve the problem that's happening in your state, in your community. And if you are a community based organization that's been doing the work in a really great evidence based way, and you have kind of a challenging environment with your governor or your state legislature, we have unlocked a pathway for that community org to get the money, kind of bypassing some of those anti folks. So, we want it to be flexible, but then we also have unlocked a pathway for the folks who are doing the work to get the money. But I guess my point is that all are welcome here. And we're really excited to work with our colleagues across the aisle to get this done.
Yeah. The Momnibus, as you noted, is actually a package of bills, so instead of a single piece of legislation. So can you talk a little bit about maybe which of those provisions is you consider the most urgent, and maybe which has been the hardest to move the needle on?
I think the most urgent is the Moms Matter Act, which is the one that addresses suicide and overdose, the behavioral mental health care aspects, just because we've seen these rates increase. In recent years, first we had COVID, then we had the Dobbs decision, and now these Medicaid cuts, and all of them are creating substantial strain and stress on moms who, once it reaches that threshold of a crisis, oftentimes they cannot find a resource in their community that is qualified or prepared to help save her life, right? And particularly around suicide, there is a shorter period between a suicide ideation and a suicide attempt in that perinatal period
Oh,
than
I did not
otherwise.
know that.
That
Yeah.
either.
And
Yeah.
I
so,
mean, the last 8 months, like, listen.
That makes sense. Yeah, that makes
you
I don't
know,
mean I don't mean to make light of it, but truly, if I think about the privileges I have, the resources I have, and how hard it has been with the support that I've had, I can only imagine
yeah.
so many other scenarios are women are just at their yeah at their wits end.
yes. And culturally, I think we're all very familiar with what postpartum depression looks like and how to support a mom who's showing those signs of postpartum depression. But if there's an anxiety disorder or some other psychiatric issue, if there's psychosis, which is happening in a really documented way, and it ends up being like that mom gets criminalized for being sick, right? Like, enters the legal system where her kids are taken away and she has no healthcare resources to even try to get well. Problem. Or if there is a substance use disorder, and now perhaps she had been clean during her pregnancy, and then with the stress of the postpartum period comes back, and it's, I don't want to say easy to overdose. It's not what I'm trying to say, but it's, you know, we see overdose rates maybe being a little bit higher during that postpartum period. We want to make sure the resources are in the community so that we're not losing moms just because the nearest resource was 2 hours away, or they had a 6 week wait period before being able to get into that provider, or there's just no beds. That kind of thing ends up being a problem. So that's the one that I feel most strongly about. It's had bipartisan support in the House. We're looking for a Republican senator to join us in the Senate. And then the ones that have been the most difficult, I would say, to advance are um, uh, really the whole package. We need a brave Republican to sign on to the entire omnibus, right? We've introduced the 14 bills individually, and then we introduced the whole thing. And this whole package is designed to be implemented and to solve the problem. So if we only take it piecemeal, we're still going to have a high maternal mortality rate. And that is unacceptable in 2026. I think the three of us are in this time when either we ourselves or all of our friends are having babies. And, we've gone past the need to raise awareness. I think we all are very familiar with the problem. I think we need to have a really solutions oriented conversation. And this is the comprehensive solution, and it shouldn't be treated as a partisan issue.
I was just thinking that, like,
Yep.
if our goal is to help women have more babies on either side of the aisle, then this should be a no-brainer for someone
Yeah.
to sign on to. So, our last question, we want to be respectful of your time, is for anyone listening, how can they help? What can they do in order to put their stamp of approval on this piece of legislation or help you get this passed?
We invite all of your listeners, your audience, I should say. We invite all of your audience to please reach out to their representative and their senators. So you have one representative and two senators. That's 3 phone calls, friends, okay? To ask them to co-sponsor the Momnibus. And it doesn't matter if they're a Democrat or a Republican, but when you make that call, please share your story. Why is this important to you? And let them know that it would mean a lot in the context of, upcoming choices that we all have to make this November for them to really step forward and co-sponsor this bill on our behalf.
Amazing. Thank you so much, Representative, for joining us today. We feel so honored to have you and to have
Thank
chatted
you.
about the Momnibus, and so appreciate all of the work that you're doing for not only the people of Illinois, but for the entire country.
All my best to you, ladies. Thank you for having me.
Thank you.